So the most shocking fact about anal fissure is that it's often a self-perpetuating wound kept open by a muscle that is spasming so powerfully, it's literally strangling its own body's blood supply. So the anal fissure is a small tear in the lining of the anal canal. It's usually caused by a passing hard stool. So the shocking part is what happens next. The tear exposes the internal anal sphincter muscle underneath. Its response to this intense pain. This muscle goes into severe involuntary spasm. This spasm, my beloveds, has two catastrophic consequences that create a vicious cycle. First, it worsens the pain. The powerful cramping spasm is itself incredibly painful, adding to the initial pain of the tear. And second, it prevents healing. The internal anal sphincter is so tight to spasm that it squeezes the tiny blood vessels that pass through it to supply the anal lining. This dramatically reduces blood flow to the site of the wound, a condition known as ischemia. So, without an adequate blood supply, the fissure cannot heal. So the patient is trapped in a vicious cycle. Pain, sphincter spasm, ischemia, poor blood flow, and non-healing fissure. Then again, pain and cycle restarts. So it's a real catch-22 of healing. The body's own protective reflex muscle spasm in response to pain is the very thing that prevents the wound from healing. It explains the razor blade pain. Patients often describe the pain of a bowel movement as a feeling like passing razor blades or shards of glass. This is the combination of tear reopening plus the intense muscle spasm, my beloveds. This is why the goal of modern treatment is not just to stitch up the tear, but to break the cycle of spasm. So, topical medications is like a nitroglycerin ointment or calcium channel blockers creams are used. They are not antibiotics or steroids. They are vasodilators that are applied to the area of chemically relax the spastic sphincter. So, relaxing the muscle restores blood flow, which allows the fissure to heal. And surgical treatment, the gold standard surgery is a lateral internal sphincterectomy, sphincterotomy, where a surgeon makes a tiny cut in the internal sphincter muscle to permanently relieve the tension. Get it? Good.